The frontline, an emergency room in a COVID hospital, just about standing under the weight of an unfolding disaster. A patient who's hardly breathing is brought in. As nurses try to get him to respond, there's another person, even more critical. Manjusha Matthew rushes to help. So many like her are putting in all they can. They couldn't revive him. To get past the shortage of beds, they've packed in stretchers, wheelchairs, as many as they can. But the first line of treatment against COVID-19 is oxygen. And they've almost run out. At this point, there is just 1 hour of supply left. The staff knows how many lives hang in the balance. People are being turned away, but they don't know where they'll find oxygen or a bed. Manora Bibi was taken in for a short while to stabilize her. We've already been to 5 hospitals. Where will poor people like us go? Her nephew asks. But this hospital is so on the brink, they have to leave. The intensive care unit is full too. There are next to no ICU beds in a city of 20 million.
These are patients in a critical condition. It's unthinkable, unimaginable that one would think of them as better off in any way. But it's the reality of what we're seeing in India. People in an ICU have won the first battle to be here.
Between seeing his patients, the doctor constantly on calls.
Back up, that's another couple of hours. So we are struggling.
He's desperately trying to get more oxygen.
We are running out of oxygen. The whole country is running out of oxygen, okay? The city is, we are, everybody is, okay? So please focus on that, please. You're doing a fantastic job otherwise, okay? Please. Okay, all of you remember that. If oxygen runs out, there is no leeway for many patients. There is no leeway, they will die.
Day after day, the staff works here, knowing full well that if their families get sick, even they will struggle to find medical care. There is helplessness and anger.
The government in some ways failed in estimating what was going to happen, the needs that would arise if the numbers started rising. There was a sense of preparation in the earlier surge which seemed to have disappeared in between. And they did things which was totally unacceptable, allowing large, huge gatherings, which is totally unacceptable. They believed that we had vanquished the virus.
Some oxygen arrives a bit later, but it can only last a few hours. Then the struggle begins again.
The government says it is trying to speed up the supply of oxygen. Railway trains